When one thinks of our transportation system, thoughts usually center on cars, trucks, trains, planes, buses, and perhaps bicycles and boats, and on getting from one place to another. These certainly are part of our transportation system. But there is another set of things to consider when thinking about transportation. They include clean air and water, economic and community development, active living, vehicle crashes, health disparities, food security, asthma, and heart disease, to name just a few. These are major public health issues that are influenced by our transportation system. In other words, our transportation system is an integral part of our public health system. We're going to talk about our transportation system and its impact on public health on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to discuss the contributions of our transportation system to the health of the public, how it affects some of the social determinants of health like our economy, the environment, racial segregation, and housing, and how it impacts diseases like asthma, cancer, heart disease, and obesity. Joining me in this discussion is Charlie Zelle, Commissioner of the Minnesota Department of Transportation, which highlights its central role in health with this value statement. Minnesota's multimodal transportation system maximizes the health of people, the environment, and our economy. Charlie, welcome to our program.
Thank you.
Obviously, from your little vision statement, health is sort of central to what you do, isn't it?
Well, it is. In fact, it's very gratifying that is vision statement is about a year old, and it really is based upon the interviews and focus groups and surveys of what Minnesotans really most care about when they think about transportation. And, fact is, it's not concrete and I-beams and bridges and roads. It is about the function that they serve, and it is about the livability, the quality of the air, the health of our economy, our people. That's the purpose that transportation serves.
So, which tells me, you've got some in your background. You've done a lot of stuff with the community as a community leader, and you ran a bus company. And what prompted you to become Commissioner of Transportation? What was the motivation behind that?
Honestly, this was not a career aspiration. Anything that at all was in my radar. But when the opportunity came, and it was a bit of an alert for me, because the reason I've had passion for transportation policy and even the bus system is that it is involved in so many other parts of people's lives. It's about connecting communities. It's about, again, the livability of our cities. And it's been a very gratifying career. And so this was an opportunity for me to expand those horizons and provide a public role to help advance, some policies and some practices that I have seen and I care about. So it's been a wonderful opportunity for me.
Yeah. So we're going to talk about that broader idea of transportation and its impact on health. But the Department of Transportation, what's its role and responsibility as a state agency?
Well, it is a multimodal agency, which is really jargony to say it's more than just roads and bridges. It's the state system, but we plan and maintain and build a number of different components. There's 135 airports, 5 ports to access around the world. There's a freight rail system, there's passenger rail system, there's Greater Minnesota Transit, which is almost every one of our counties. And really gets down to it, we do a lot of the standard setting from everything from speed limits to safety practices, sidewalks, livability issues. So it's really fairly far-reaching.
And so when I talked in my introduction about cars and trucks and buses and airplanes and boats and bicycles, you're concerned about all of those
Truly
things?
is all of the above. And the fact is that all fits together as one unified system. Often we think, well, there's transit here and roads are over there. No, actually, buses run on roads. And as we think about moving people around the city and the states, it is important to consider that people have choices about how we can move and get to jobs, school, And sometimes it's finding the most efficient, sometimes the most affordable, and sometimes the most healthy way for us to move both freight and people.
Does the general public get this broader view of transportation? I mean, because transportation is certainly a huge issue right now. We're talking about infrastructure and investing in roads and bridges, but do people understand that it is multimodal and that it has impacts on a variety of things, not just getting from point A to point B?
Well, I think people get it intuitively. And of course, you know, our agency touches everybody everywhere in the state. So, you know, if you're in a town of, say, Red Wing or Duluth or Bemidji, not just St. Paul, you might actually leave your home and you would walk on a sidewalk, you might take a bus, you might drive your car, but people kind of get intuitively that all trips, whether you're sending a package or walking or driving yourself, involves a lot of different kind of ways of making those trips. So I think that what gets confusing for many Minnesotans is how we fund this system. That is complicated. Generally a user fee kind of system, but that's been the part for me to get out, travel around, and talk about that.
Yeah, so there are many parts of the system, and
Yes.
it's funded in a variety of ways. It has multiple impacts. What sort of values does your agency bring when you're starting to plan these things? You know that there's some environmental impacts, there's some people impacts, there's some business impact. What are the sort of the guiding principles that you use when really coming at how to move forward with a project?
Well, you know, the first, that vision statement really does set a tone. You know, our purpose is not just to move as many people as possible. It is, but we have a lot of other kind of standards and metrics that we look at. And I think we're expanding them based upon what Minnesotans really want. Certainly, we want to be able to move traffic or buses or people as efficiently as possible, so you're not really stuck, you know, in bottlenecks. But we look at safety, and you know, we work a lot with your agency on our 2-0 death program. I mean, this is about actually reducing fatalities on our highways and bridges, and we're able to do that in collaboration with public safety and, you know, the engineering, the enforcement, the emergency response, and the education all comes together. And so our values, when we look at how we create safe environments for our people, that's a very strong guiding principle. And then also we look at how do we impact the quality of the air? How do we impact the livability of a community? You know, it used to be Main Street would also be a state highway. So if we have the state engineers saying, let's have those trucks go through town as fast as possible, and the community itself saying, wait a minute, this is where we have our shopping. This is where we go to the movie theater. This is our kind of small Main Street where we're in conflict with the traffic is coming right through the town. We have found that without disrupting that artery, you can slow traffic down, not necessarily with a sign, but with how you design the road to make it just a little bit more livable. And so the idea I think we've had is to have values where we aren't having one set up against the other, that we can kind of embrace all of the picture together.
Mm-hmm. Well, you put together, you or your agency put together a little video, which I think really explains a little bit about what the agency is all about. So let's run this video right now, and then we'll come back and chat after it.
Sure.
A to B. It's a journey we Minnesotans take every day. A to B. A to B. And between every A and every B, there's a road, a bridge, a rail, a runway, a bike path, or a waterway connecting them together. A to B. We all have a big stake in A to B. It connects us to our faith and our schools. It connects us to our work life and our play life. It connects us to our heroes and our weekend getaways. A to B. It keeps our economy strong by connecting people to jobs and businesses to workers, by connecting our 81,000 farms to markets here and around the world, by connecting the products we make to the people who buy them, by connecting A to B. It's an interconnected system of roads and transit that belongs to every single one of us. And now it's time for that system itself to make its own journey from A to B, to make the journey from a system that works for today's population to one that's ready for the growing and changing Minnesota of tomorrow. A to B. To move from a 50-year-old infrastructure to one grounded in the newest technologies and sustainable materials. A to B. It's time for a system that delivers more goods to market faster and more efficiently. For a system that makes Minnesota an irresistible destination for business, helping us compete for talent, jobs, and economic growth. It's time to move from costs to cost controlling, from fixes to solutions, from yesterday to the next 20 years. It's time to make a transportation investment that helps all the people of Minnesota, because what's good for small towns is good for the metro. It's time to not just think about the future, but plan for it, build it, and prosper from it. It's time to be a place that other states point to and say, like that, we can get there. We've just got to keep moving. Spread the word to help us keep ahead.
Welcome back. We're chatting with Charlie Zelle, the Commissioner of the Department of Transportation in Minnesota. Charlie, what struck me about that video is that transportation is really not about planes and cars, and it's actually about people. It's about communities. It's about businesses. It's about, quality of life. Is that sort of your picture of what you're doing?
Yes,
improving the quality of life for everybody?
I love that video. Thank you for showing it. I never tire of watching it because I think we as Minnesotans, we're so proud of our state. It is so beautiful, and we have a robust arts culture and a robust natural environment that we can go in greater Minnesota. There's every parts of it, and in every step, the access we get to the Minnesota we love, the economy that's prospering. Really, the transportation system is a foundation that enables all that, and I think that that is what is gratifying about transportation system, and it is aging, and we have to kind of tell the story more explicitly that we have to take care of the system we have if we want to preserve the Minnesota we love.
Well, one thing that strikes me in my world, I think in our world in general, is that things are changing so dramatically. Our demographics are changing, our technology is changing, our economy is changing. How has the transportation changed, evolved over the last 50 years, and what kind of evolution is really needed for the next 50 years?
You're exactly right. I mean, transportation has evolved considerably. I have a big picture. It's about 3 by 4 feet in the hallway outside my office, and it's a picture of a dirt road and a beautiful farmhouse, and there's a rickety old bus that's marching down that road, and that's actually my grandfather's bus, who was operating between the Twin Cities and Rochester. It used to take 4 hours. There were 7 trips a day. So when folks come to me and say, geez, we need to do some improvement on Highway 52, and I point to the picture and I say, we have come a long way. And we continue to. We have to continue to reinvest to maintain the system we have because, it turns out pavements and bridges and foundations don't last forever. We have to maintain them, we have to preserve them, then occasionally we have to replace them. But as we think about the systems, let's make sure that they're resonating with the technology, the innovation, and the way people are using the system differently. You think about bike shares that are in our major cities now, and even car sharing. The new generation of users of transportation don't think of it differently, and we have to make sure we have a system that's resilient and adaptable to those kind of new populations and what's and the way they want to use the system. So we're thinking about that.
Do people have different expectations? You know, let's say from the 1960s to the 2010s. Are people expecting different things from their transportation system?
Well, one thing, and we think of it differently, is that we do more than just plop a big highway down in the middle of a city or in the middle of a cornfield. I mean, our care in making sure that we incorporate our transportation work with existing communities has really evolved. In 1960s, when I-94 was built right through a community, that was so disruptive to neighborhoods, and we actually take care, sometimes disruptive, to think about how we can do what we do without as much impact. And the second is we have to make sure that whether it's new technologies that are inside cars, which is evolving quite a bit, or just how we manage traffic with signals, signs. We have a major traffic control center in Roseville, which has TV cameras, which you can almost see anywhere in the metropolitan area. We can actually look and see what's going on, and we have little first help trucks that will go and help manage traffic and safety at a moment's notice. So we actively manage a system that was unheard of 20 years ago. So we think about how this is continuing to evolve. We got to be both not, I would say, cutting edge, but definitely within what is required and what we know is best practice around the world.
So how do you get input from the community? I mean, you know, obviously putting a road through a place, or
Yes.
changing, you know, with needing bicycles and bicycle paths and multimodal transit. How do you get input from the community in a way that is really effective for you?
Well, I think public hearings is always a great way. I think reaching out to neighborhood groups and, frankly, working with other agencies. Thank you very much, Commissioner, for the work we are doing with the Department of Health, both in having pedestrian workshops around the state and putting together a bicycle plan, a pedestrian plan for the state of Minnesota. I mean, I think we'll probably be the second state that actually has a pedestrian plan statewide, showing what are the proper, best ways to design safe and livable places. And we do that in conjunction, like I say, with public health folks. Sometimes we work with chambers of commerce. Sometimes we work with elected officials. The important thing is that there's plenty of opportunities for the public to engage both in planning and advocating for projects that are meaningful for their communities.
Right. Well, we've talked fairly generally, and I want to get to some specific issues.
Yes.
But first, we need to take one more little break.
Okay.
We'll be back right after this message. Welcome back. We're talking about Minnesota's transportation system with Charlie Zelle, the Commissioner of the Department of Transportation. Charlie, you talked a little bit about walking pedestrian plans. Something that we've been working on with local communities and schools are complete streets. What's a complete street?
Well, a complete street is just kind of as it sounds. Rather than repaving a road from curb to curb and think about just cars, complete streets is a much more comprehensive view of really entire public space. You think about it building to building. There's pedestrian, there's transit, there's bicycles, cars. How do they work together in a way that's complementary as opposed to in juxtaposition? And really some great new design standards kind of help cities and guide departments of transportation to have a more comprehensive view toward toward balancing livability and in traffic zones.
Yeah, and as I go around the state, when I see some of the towns where they've done complete streets, they've seen it as an economic development tool.
It's remarkable. It has so much success, and I think as we complete and work in collaborations with counties and municipalities, those success stories are so tangible that now more and more communities want what St. Peter has or Battle Creek. And boy, this last year we tore up Alexandria and building to building. But you know what? Here's a very efficient way to manage a project too, because the city of Alexandria had to rebuild their sewer systems. Well, while we're repaving the main street, let's just do it all at once, and then put in better lamp posts and cutaways for parking and a wider sidewalk, because you know that's how retailers sell their goods, or sidewalk cafes can create an ambiance that people want to be visiting the downtown. That actually has become an economic center.
Yeah, actually I did visit Alexandria, and the business community was loving the complete streets. Related to that is safe routes to school. I mean, a lot of kids move back, are transported or get transported back and forth from home to school. Are you involved with school systems and communities and safe routes to school?
Absolutely. Safe Routes to Schools was initially a federal program, and we've been keeping it alive in the state. It's got bipartisan support, I'm really pleased to see, because it affects both, again, safety and livability. And it's a way to both have training programs as well as some curb cuts and actual physical changes to allow for our kids to get to and back to schools. And frankly, with a little bit of walking and exercise, it doesn't hurt our kind of physical health as well.
Exactly. One thing related to physical health is air quality, and I know in the Twin Cities we've had a lot of air quality alerts. How do you engage in improving air quality, since automobiles are a huge contributor to that?
Well, we recognize that maybe a third of our climate gases really come from the transportation sector. And so part of a multi-agency task force came up with some possible solutions to deal with air quality alerts when the particulates are in the air. And just recent air quality alert, we saw for the first time some of our alerts being on the MnDOT signs over the highways. I think that also was unheard of, but we actually are suggesting, you know what, this is a time to reduce your driving. This is a time to reduce idling. And I think it helps build an awareness that when we drive our cars, we actually are, we should be doing it expeditiously, because it does contribute to what's in the air. But I think more importantly, being part of the Environmental Quality Board with other commissioners, we realize as multiple agencies, we can have a bigger impact by working in collaboration toward larger goals.
Yeah, so pollution control obviously is interested in that, so good partnerships with health, pollution control, and transportation in making that happen.
Absolutely.
The other thing that's happening in the state is we're becoming much more racially diverse, economically diverse. How do you play in different cultures who come from different backgrounds and needing a transportation system that has been built up in the United States, in Minnesota?
You know, that's exactly it. When you think about, we always say we can build bridges or we can build barriers. Let's build bridges. And we bridge communities because geographically isolated areas can be really in a difficult strait. So whether it's a bike bridge across a highway or actually providing great transit stops and transit connections is really critical. So we know that our population is changing dramatically throughout the state. And we know that if we think carefully about ways not to isolate communities, but provide choices, access, and everything from multi-language guides and having proper signage, that's something where you realize, again, this is not about concrete. This is about how do we make our system accessible and welcoming for those people who, frankly, we want to attract to our area, because they're our future workforce, they're our future.
Well, then it was really evident in the Green Line, putting 3 stops in a community, particularly a community of color that wasn't there initially, really got them engaged in this whole transportation discussion.
And if it wasn't for the advocacy of that neighborhood groups and the Federal Transit Administration actually responding by changing the metrics, it's not just about how many bodies you have on a train, it's how does it provide economic impact, and how does it provide the benefits for the communities along a line. And I think we have really shown some great work by not just building that Green Line, but actually how it works, how it has tentacles into the community, and how it's resulted in some great economic benefits.
Right. Well, we just scratched the surface of all of the things that transportation does related to health. So thanks for the work that you do and your staff. I mean, you really do have a bunch of public health professionals in your staff working on a lot of these issues. So thanks for being with us.
Well, we love working with the Department of Health, and thank you very much, Commissioner.
And I'll be back with a closing comment right after this message.
They say that when you're facing extreme danger, your life flashes before you. If you think that's sad, consider facing it before you even have enough life to flash before your eyes. Deaths and injuries can be prevented by using the right car seat. Visit safercar.gov/the-right-seat to know what is appropriate for each age and size.
Although we have the Centers for Disease Control and Prevention, or CDC, and state and local health departments who are charged with providing a variety of public health services, the health of the public is not just their responsibility. Public health is the responsibility of all of us. Public health is not just a place of employment. It is more of a philosophy of life or an approach to making our communities better. If you're concerned about the overall health of your community, if you think health is both an individual and a societal responsibility, if you think being well means more than just being physically healthy, if you would rather prevent a problem than treat it, and if you see yourself as part of a team responsible for keeping people safe and healthy, then you are a public health worker. And as we saw today, the staff of the Minnesota Department of Transportation certainly fit the definition of public health workers and are part of the public health team. So no matter where you work, you can also advance the health of the public by promoting programs and activities that protect and improve the overall health of the people in your community. All of us need to be public health workers because, as the Institute of Medicine said, public health is what we as a society do collectively to assure the conditions in which people can be healthy. People working together can do a lot more than individuals working alone. And the effort of all of us are necessary to create a healthy future for our state, country, and the world. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.